Now I'm going to inspect your external ear. I'm looking for any deformities, any lesions, or lumps on the ear. I'm going to take a look in your ear with my otoscope here. And looking at the tympanic membrane, making sure that it's intact, that it's a pearly gray color, there's no bulging or effusions, that the bony landmarks are present, and that there's a sharp cone of light at 5 p.m. I would come around here and do the same thing, the left ear, making sure there's an intact tympanic membrane, there's no bulging, no effusion, I have a sharp cone of light at 7 p.m., and that the bony landmarks are also present. Now I'm going to take a peek up your nose with my otoscope. And what I'm checking here is that the nasal mucosa is pink, it's intact, the vascular pattern, there's no nasal drainage. I'm looking at the turbinates, making sure they're not swollen or boggy or red and inflamed. Also looking at your septum, checking to see if it's perforated, deviated, if there's any ulcers or polyps present. Now I'm going to palpate your frontal sinuses. Any pain or tenderness with that?
No.
And your maxillary sinuses? Any pain or tenderness with that?
No.
Okay. And can you wrinkle your forehead? That tests cranial nerve 7. Can you smile? And puff your cheeks out. Again, testing cranial nerve 7, and we're looking for symmetry. Now I want to look in your mouth. First of all, can you stick your tongue out? Say ah.
Ah.
Move it side to side. And then say light, tight, dynamite.
Light, tight, dynamite.
Good. And that's testing cranial nerves 9, 10, and 12. Making sure, again, that's symmetric. I'm going to take a peek in your mouth now. Say ah for me one more time.
Ah.
Okay, and just looking around my light. I'm looking at the oral mucosa, making sure that there are no ulcers or lesions, that the tongue is midline, the uvula is midline. Tonsils are grade 0. Dentition is good. There's no loose teeth, missing teeth, or dental caries in the mouth. I'm also going to test cranial nerve 8 now. So I would take my tuning fork, hit it, place it on top of her head, and she would tell me that she should hear equally on both sides in this test for lateralization. And then I would test for the Rene test, which also tests cranial nerve 8. Take my tuning fork, place it on the mastoid bone. Tell me when you hear the noise stopping.
Stop.
And again in the front, tell me when you hear it stopping.
Stop.
Okay, so this tests air conduction versus bone conduction. Now I'm going to feel your cheeks here. Can you clench your teeth together and move them side to side? And that tests cranial nerve 5, the trigeminal nerve. I'm going to feel your lymph nodes. And looking to make sure that your trachea is midline. I'm going to feel your thyroid swallow. Okay, and looking for any enlargement or lumps on that. Now, can you place your, push your head against my hand on the other side, and then lift your shoulders against my hands. Okay, and that tests cranial nerve 11. Stop.